Okay, yes, I'm glad you asked. GLP-1 is pretty much a hormone that is made in the gut. It stands for glucagon-like peptide 1, and we all make GLP-1s in our gut. However, we found out that GLP-1s, they increase your ability to process sugar. So when you have sugar in your blood, it causes your when it's secreted, it causes your pancreas to release insulin. And insulin helps move sugar out of the bloodstream into the tissues where it can be used for energy. So that's the GLP-1s. So we have two types of GLP-1s currently that are very popular in the market, and you guys may have heard of them. And it's Semaglutide, and the other one is Tirzepatide. Semaglutide is GLP-1 by itself, and Tirzepatide is GLP-1 with something called GIP. And what the difference between them, they both have GLP-1, so they increase your ability to mobilize sugar. That's why it's good for diabetes. By the way, those medications were initially created for diabetic patients, and then they found out that people were losing weight for different reasons, and they started looking into it, and they found out that it's good for people with obesity issues, people who are overweight. So the GLP-1s, again, they increase your insulin production to allow you to move sugar. They also slow down the way food moves to your GI tract, to your gut, in your gut. So it slows down the way food is moving, so that way it causes you to be less hungry because you feel full, because the food has not really gone through your GI tract fast enough. So it allows you to feel full longer. And also it decreases your appetite. You're not hungry because it also has different receptors in the brain that increases your what they call the satiety center in your brain, so to allow you to not feel hungry. It helps with the noise craving that you have. It helps with people sometimes can't stop thinking about food. It helps regulate that as well.
Right.
Now, Tirzepatide does all the stuff that I described with GLP-1, with the semaglutide, but it also has a special process where it helps with fat metabolism, and that is why it seems to be more effective than semaglutide. A lot of people start with semaglutide and then they end up in Tirzepatide because Tirzepatide helps with fat metabolism. So it's actually moving fat out of the cells and burning them. Well, it's not for everyone. It's for most people can safely take it, but you have to do I do a deep, in-depth history of the person. So categorically, you do not want to use it in someone who has a history of thyroid cancer, a family with history of thyroid cancer, or other endocrinological cancers. That's a no-no. And also, if somebody has had pancreatitis, you do not want to give it to them. If somebody has a history of low blood sugar, it's not a good idea because it will drop your sugar, and that can be drastically that could be dangerous. If your sugar drops too low and no one's aware, you could be in a coma. So we also do not recommend it for those people. But for the most part, it's good for anyone who wants to lose weight, people who have difficulty losing weight for different reasons, slow metabolism. It has been very successful to help people reach their goals and keep the weight off. So, especially semaglutide, you can have a lot of nausea, bloating, people can vomit. So what it is, it causes because it slows down the gastric emptying, meaning the way food moves from the time it hits your mouth into the gut. If you eat too much, it will cause people to be really nauseated, and some people can vomit. And so that's one of the things that I would want people to be aware of. These are the most common side effects of it. They're not life-threatening, but they are side effects that we need to be aware of. And you want to start at a very slow dose and be monitored by a physician or a nurse practitioner, someone who knows what they're doing with that, and not just getting it randomly and not knowing what dose to take. Okay. Well, it works great. Once you take it, a lot of the time it's going to be for long term, because the issue that people have had in the past that caused them to not lose weight they pretty much will come back once you stop the medication. However, we have ways to teach people how to eat healthy. So the whole time that, let's say you're on it for 3 to 6 months or more, during that time you've learned to reset your habits and get into good, better eating habits and guiding you so that way when you get off the medication, you're not going to, get all the weight back. It's a possibility. So what I do, I put people on a maintenance dose where they come and get a little bit once a month or every 2 weeks, a small amount to keep them from getting the weight back. And encouraging them to eat healthy, to take the vitamins and to exercise and to build muscle. Another thing that I want to mention, a person can lose a lot of elastin from their skin while they're on this medication because it's fat. It's pretty much it's attracted to the fat in the face. So you've heard of Ozempic face where you become hollow. So it's something to consider. And what I tell people is to try to lose weight slowly, to take a biotin for hair loss. You can have hair loss. To take collagen, amino acid, omega-3, the good fat, so that way you're not losing the fat cells. And it can happen. And to do good skin care while you're on this medication, to hydrate your skin, take good care of yourself, and to do it gradually and not to try to lose too much too fast. Because the loose skin can become a problem for people.
Yeah.